Let's stick with COVID, because Australian research has shown the value of our obsession with social media on our mobile phones. It can tell where we are when, and that can translate to invaluable information about the spread of COVID clusters a long time before the testing discovers it. The lead author was Cameron Zackerson of the University of Melbourne, and I spoke to him earlier.
Mobility data allows us to potentially track the spread of an infectious agent because it is human interaction that spreads the disease.
And what potentially could that tell you that the contact tracers are not finding out about?
Well, contact tracing requires cases to be identified. So what it could tell you is where you may have unidentified cases.
So tell me how you do your research. What data do you use?
We use data from Facebook. It's collected by a part of Facebook called Facebook Data for Good, and they aggregate the GPS data collected from mobile app users, and then they release it to academics for research purposes.
And so because it's on the mobile phone, you can track where they've been?
Precisely.
Does this narrow the population group that you're looking at?
Yeah, the coverage varies. In some areas of Melbourne, for example, the proportion of people using the app can be as high as 20%, and in other areas it can be as low as 5%.
Tell me about this study that you did.
All we did was take the mobility data, use that to make a rough prediction of where new cases would arise, and then compare that to the subsequently identified case data.
And you looked at the Cedar Meats outbreak in Victoria and the Crossroads Hotel outbreak in New South Wales.
Yep, that's right.
And what did you find?
We simply found that for the Cedar Meats outbreak, the correlations between the predictions that we made based on mobility data and where cases were subsequently identified were quite high. And for the Crossroads Hotel situation, the correlations were still significant, but not quite as predictive in that case. We believe it's because the Crossroads Hotel outbreak was based around an intermittent social event. It wasn't an outbreak center that was characterized by habitual movement patterns like the Cedar Meats outbreak was.
So in other words, you had people going to work every day at the Cedar Meats factory, whereas you had one group of people who got together, somebody arrived from Victoria, spread it to maybe 15 or 20 people, they moved on. You couldn't use the Crossroads Hotel as your anchor point, if you like, in your mobility data. Is that what you're saying?
It still worked decently well, just not as accurately in that case.
And how far ahead, in terms of the test results?
About 3 weeks.
3 weeks? And I noticed you say in your paper, this is much better at the beginning of an outbreak when the numbers are low because you can get overwhelmed. So if they had known what you know now, and you say, well, I'm predicting 3 weeks ahead that you're going to see more cases in the northwest corridor of Melbourne, how would you expect the authorities to respond differently?
It's possible that testing efforts could have been allocated differently if that data had been taken into account, perhaps. I think it's also good for public awareness because if people see one of these maps and they go, oh, I live there, then they might have a heightened awareness of the risk of transmission in their local area.
Early on in the first wave, mobility data from a different source, I think it was from Google, were used to show whether or not lockdown was working, to show, for example, people using Google Maps and traveling around in their car, the number of car journeys to assess how good lockdown is. Can your data show how good lockdown is in social distancing?
Yeah, it's very useful for that sort of thing. We did that as well.
Have you been consulted by health departments since your publications to actually do some work on this area on real outbreaks now?
Yeah, we have. So for the Avalon cluster, we were contacted by New South Wales Health. Also, during the community transmission area in Victoria, when the virus appeared to be spreading into urban fringe areas.
And are you aware that it made any difference or targeted effect?
I'm not aware of exactly how the information was used.
And is it expensive to do or relatively straightforward?
No, it's quite straightforward. In fact, we're currently developing a web application that will allow anyone to do it for themselves using a secured version of the data source.
Now, you might get a little bit troubled by this, that you're using Facebook data. And even though you've ticked the terms and conditions, you might be surprised that this data could be used for this purpose.
Yes.
I mean, can this be found where you were on a certain date at a certain time?
So let me be clear that Facebook is collecting individual level data, but they're not releasing that data to us. What's released to us is already de-identified and aggregated. Any numbers small enough to be used to identify individuals have been completely removed from the data set, which affects its utility, especially in rural areas with smaller populations. But that's the price to pay for privacy. I can be very confident in saying that there is no way to identify an individual in the data set.
Cameron, thanks very much for joining us.
You're welcome. Thanks for calling.
Dr. Cameron Zachrisson is in the Faculty of Engineering and Information Technology at the University of Melbourne. You're listening to RN's Health Report, and I'm Norman Swan.